course, there is the serious matter of what's happening with the AstraZeneca vaccine, isn't there, which is the under-30s now being offered an alternative. And the question is, if you've already had the first one, say if you're under 30, and there are lots of people, Michaela on Twitter, my 25-year-old daughter's had the first dose of AstraZeneca vaccine on Tuesday. We're obviously now concerned, should she have the second dose?
Yeah, there's lots and lots of questions, isn't there? It's not going away, the links with blood clots. Dr Amir is with us this morning, as ever. Morning, Amir. Nice to see you this morning.
Morning.
So, look, I just wonder how much of a blow is it that, yet again, the government are having to make changes to the AstraZeneca vaccine and who it is that receives it, and the fact that anyone under 30 will now be offered a different vaccine?
Yeah, so it's important to know that the vaccine is still very safe. It's still highly effective in preventing illness from COVID. But the information has changed since this time yesterday. The MHRA and the JCVI have updated their guidelines, and people between 18 and 29 should be offered an alternative to the Oxford AstraZeneca. I think it's important to acknowledge that there will be a bit of denting of public confidence as a result of this, but it's really important to get the message out there for the vast majority of people. This is still a safe and effective vaccine which will prevent hospital admissions and reduce thousands of deaths.
There are many other vaccines available. I say many. The Moderna one has come online, hasn't it? We've got the Pfizer one. There's others. So if you've already had the first one and it is the AstraZeneca one, and you're under 30.
Yeah,
what
as
will
Michaela's saying there, she's got a 25-year-old daughter. She had her first dose.
Yes.
They're very nervous about the second dose. Should they be?
No, they shouldn't be. If you've had your first dose of the Oxford AstraZeneca vaccine and you're under 30, chances are you have an underlying health condition which puts you at increased risk of complications of COVID, or you work in a setting which exposes you to high levels of COVID. There, the benefits of having the Oxford AstraZeneca vaccine outweigh the risks. And if you've already had the first dose, you should go ahead and get the second dose.
Also, Mel on email has an interesting question. Would having half an aspirin a day after having this jab help reduce the possibility of getting a blood clot?
No, there's no evidence of that yet. These are very complicated blood clots in that there's a bit of clotting and some bleeding going on at the same time. So it's a very complicated kind of pathology, and there's no evidence that taking an aspirin before or after the vaccine will reduce your risk. That may change in the future, but right now the evidence is not to do that.
OK, quite a few other things here as well. People are worried about if they're at risks of blood clots already. Should they even have this vaccine?
That's a really common question, and certainly yesterday afternoon when I was in surgery we got a lot of calls around that specifically. The general advice is yes, you should have it, but if you are worried and you're at increased risk of developing clots because of medication you might be on or underlying health conditions, talk to your GP, who will know your full medical history and get that risk-benefit balance right, and they will be able to advise you as to which vaccine is best for you.
OK, and what about symptoms? I mean, how can you tell if you're getting clots? What are the symptoms of the clots? Because people will undoubtedly be starting to sort of worry nervously about, is that something I'm feeling? Is that a blood clot I'm feeling?
Sure. So the symptoms will depend on where the clot is. So let's start with this very rare blood clot in the brain, the cerebral venous sinus thrombosis blood clot. That we advise if you have a headache that persists for 4 days after the vaccine, and the risk peaks around 10 days but can go on for 2 weeks. If you have a headache that doesn't respond to painkillers like paracetamol, you should seek urgent medical advice. Certainly if you get blurred vision or if you're feeling faint, losing consciousness 4 days after the vaccine, that's when you should seek urgent medical advice for this blood clot in the brain. Blood clots in the legs are slightly different. You can get swelling and redness around the leg. In the lungs, sudden onset shortness of breath, chest pain, that should alert you to a blood clot and you should seek medical advice. And again, rare blood clots inside of the tummy. If you get any swelling or sudden tummy pain after the vaccine, particularly around that 4-day mark or beyond, you should seek medical advice.
And there's interesting comments on the front of the Daily Telegraph from one of the first people to have spoken out about a family member having died from a blood clot. And it's the family of a 59-year-old lawyer who worked in Warrington. He's called Neil Astles. And he died 3 weeks after getting the first dose of the AstraZeneca jab. And it's interesting because, of course, the family, you would expect, would say, you know, gosh, this is obviously dreadful, which they are. But it's interesting because the sister is also in the medical field. She is the lead of teaching pharmacy at a university. And she has said, emotionally, we are completely and utterly furious. We are suffering. But there's nothing in our minds to be really furious about. My brother was just extraordinarily unlucky. And it's interesting, she goes on to say, if we all have the vaccine, a few of us might have a blood clot, but the evidence is that fewer people will die. We trust the process, we trust the regulator. And despite what's happened to our family, we don't want people to be scared off. That's the message we want to get across. And that is so strong, isn't it, from a family member of somebody who has died from a blood clot, Amir?
Yeah, really strong. My thoughts certainly go out to the family there of Mr. Astles, and he was certainly very unlucky. The risk of having a blood clot is so small after the AstraZeneca vaccine. I understand he was 59, so certainly the benefits for him or that age group do outweigh the risks. But it is important to listen to what his sister has said there. They are right to be upset. You know, anyone who's lost a family member will feel the same feelings. But she's also right to say to trust the vaccine and the rollout of the vaccine, because it will save thousands of lives. And that's the important thing to remember.
And just to put it into context again, so 20 million people have had the dose, and out of those, I think 79 people have had blood clots, 19 have died. And in comparable terms, you know, that's the equivalent of what? You know, just to put our minds, the things that we already take, the things we already do in the medical field, this is equivalent to what kind of thing, that the risk we already live with?
Well, the risk is incredibly small when you look at it like that. If you look at things like long-haul flights, if you go on a flight that lasts more than 4 hours, you've got a 1 in 4,500 chance of developing a blood clot. So you're far more likely to get it that way. But really importantly, this vaccine prevents illness from coronavirus. And if you were to get coronavirus, you are far more likely to get a clot. You're 11% chance of getting a clot in your leg, and almost 8% chance of getting a clot in your lung. And if you were to end up in ICU, which again this vaccine helps prevent, you've got a 23% chance of getting a clot overall. So the risk from getting a clot from coronavirus is far higher than from the vaccine.
And we know that the statistics are continuing to fall, aren't they? The number of cases and the number of deaths certainly are coming down, Amir.
Yeah.
Yes, so this is some good news from the REACT trial or study. They say that there's been a 60% reduction in the prevalence of coronavirus cases between February and March. And they're looking at people where they've done swabs on to look for the presence of the virus. The biggest drop is in the southeast and the London area. There are still some stubborn areas around Yorkshire, the East Midlands and the Northwest where the rates aren't coming down as quickly. But overall, there's been a 60% reduction in the prevalence, and that is good news. And that's partly because of the vaccinations.
Yeah. And just one other thing that we can touch on quickly, because there's some modelling that's suggesting that on Monday the 12th, we will actually have hit 73.4% of the population having been vaccinated or having had the infection, which actually is the benchmark for herd immunity to be achieved. That seems like that's, I mean, it coincides with, as we know, a number of lockdown restrictions being lifted again. But that's an important milestone, isn't it, Amir?
It is an important milestone. This is modelling by University College London, suggesting, looking at the data and any projections going forward, that by Monday we should have reached around 73.4% people with antibodies, really, from either a previous infection or vaccinations. It's important to remember that it is just modelling. It's not based on real-world data or just real-world data. And a similar study done by Imperial College London up until the end of March put that at 34%. So I wouldn't rely on that so much just yet. I think it's really important to stick to the rules and get vaccinated more than ever.
So one study got it at 34% and one study got it at 73%?
Yes. Well, there's slightly different timelines.
Yeah.
The one for Imperial College was towards the end of March, and this is the 12th of April, but they're not that far apart. So I would just be very mindful.
I suppose the vaccination programme has been rolling out so quickly, in a sense, that actually, even week on week, I imagine that the population's immunity is is exponentially rising.
But there is positive news out there as well, so that's what we want to hold on to.
Yes, we do. We certainly do.
Dr. Amir Khan is with us again. Amir, as you can imagine, lots of our viewers getting in touch with us this morning with their concerns. The main concern has been from mums, it has to be said, mostly saying they have an under 30-year-old who has already had one of the AstraZeneca vaccines because they have an underlying health condition, and they are concerned about whether they are safe to take the second of those AstraZeneca vaccines. Can you put their minds at rest?
Yes, and that's a really common concern. We're getting calls just like that at the practice as well. Now, if you're under 30 and you've had one dose of the Oxford AstraZeneca vaccine, that is probably because you have an underlying health condition, which means you're at increased risk of developing complications should you get coronavirus, including blood clots, or you may work in a job in the NHS or in social care, which means you're at increased risk of catching coronavirus. The risk of developing a clot from the vaccine is incredibly rare. You know, it's less than 1 in 250,000. And so if you have had the first dose, you should go forward and get the second dose. It's safer to do that than risk catching coronavirus and getting a clot from there.
Michelle's got a more specific question about her 21-year-old daughter who actually had a stroke last year caused by a clot in her heart. She's obviously already had the first Oxford vaccine, because at that point nobody really knew about this link, did they? Is it safe to have the second one if a blood clot is something that you've experienced and it's caused you a stroke as it has done in a 21-year-old?
Yeah, so it's all about weighing up the risks versus the benefits. In this case, with this 21-year-old, the benefit of having the Oxford AstraZeneca vaccine does outweigh the risk, because again, should this lady get coronavirus, she may well develop serious complications, because already she's got an increased risk of developing clots, and the coronavirus will increase that risk. And it far more increases it that way than if you were to get the Oxford AstraZeneca vaccine. I know it's worrying when you've had a clot already, and if you haven't had any doses of the Oxford AstraZeneca vaccine and you're at increased risk of developing clots, you should discuss that with your GP to see what the risk benefit balance is. But if you've already had one dose, then it is advised you go forward and have the second dose. OK,
had this email from Stuart. We've heard a lot about the blood clots associated with AstraZeneca. Obviously, the very few, very rare blood clots, Stuart, let's be clear about that, and the vaccine. We don't hear much, or we're not hearing much about the risk associated with the other vaccines. Are there risks associated with the other vaccines that we need to be aware of?
There's risks associated with all medication. No medication is risk-free, and you can say that about aspirin and paracetamol and ibuprofen, the medication that lots of people take every single day. Yes, there are risks associated with the other vaccines as well, incredibly rare risks, but it all goes back towards that risk-benefit, and the benefit of getting any of the vaccine in the vast majority of people outweigh those risks. And it's really important to know that, yes, we are focusing on these blood clots and the risk, but the truth is that these vaccines so far have saved thousands of lives, and it's really important we carry that on.
Finally, people are asking about what the symptoms might be if you feel like you may have had the vaccine and then a few days later you feel a bit poorly. Amber on email said she had the jab, the AstraZeneca one, 2 weeks ago. And for the first 2 nights, terrible throbbing in her calf under her knees. She stood up at ease, then the pain when she was sitting down. It's excruciating. Is this a possible sign of blood clotting? Now, she did have it 2 weeks ago. She says she's actually really concerned now. She's 48, generally in very good health. Should she now have a different jab?
Yeah, so after any of the vaccines, it's common to get muscle aches, headaches, fevers, flu-like illnesses. But if Amber's symptoms resolved after those first 2 days, it's unlikely to have been a clot, and she should go forward and get the second dose. The symptoms of the clot in general vary depending on where the clot is. So the MHRA have said if you have symptoms beyond 4 days after having the vaccine, you should speak to a GP, and that could include headaches and blurred vision if the clot is in your brain, shortness of breath if the clot is in your lungs, swelling of the leg or arm if that's where the clot is, or pain and swelling around the tummy area if that's where the clot is. But it's so important. Every time I talk about clots, it's really important that I say these are incredibly rare, and for the vast majority of people, the benefits outweigh the risk. And this, we're only changing the course for people aged 18 to 29, and there are other vaccines available, and it's right that they are offered there.
And which is why it's important to say what the symptoms are, because they're quite, important to hear that, and you go, OK, I'm all right, I've not had any of that.